Welcome back. I'm RuthAnn, and this is For Those Who Care, a podcast dedicated to caregiving. Today, I'm speaking with Chanda Hinton, who has lived with a spinal cord injury since childhood and now leads the Chanda Center for Health in Lakewood, Colorado as Senior Executive Director. She's both a lifelong care recipient and a nationally recognized advocate who's built an innovative model that puts caregivers at the heart of integrative health. Chanda, welcome, and thank you so much for joining us.
Thank you so much for having me. I'm really excited to be here today and to have a great conversation about healthcare and disability and caregiving.
Well, I would love to hear your story in your own words. How and when did your spinal cord injury happen, and what led you to start the Chanda Center for Health?
Yeah, absolutely. So when I was 9 years old, I was accidentally shot in the back of the neck. So it was between the C5, C6 part of my cervical spine. And so I am a quad today. I function with the assistance of a power wheelchair, an accessible van, a service dog. Granted, he's retired right now, so that he doesn't do as much service anymore. But that injury from when I was 9 years old, resulting in a spinal cord injury, has it threw me into a medical model. It threw me into kind of not really having a choice about having a relationship with healthcare, because that's what I needed. And not only did I need it because I needed that acute intervention to save my life when I was shot, but then as I went through rehab, it became kind of like this, here's your injury, here's your wheelchair, and here's all the medications to address your secondary conditions. Unfortunately, that's not the recipe that myself and a lot of folks with long-term disabilities can thrive with. So for example, because that was only the regimen from 9 until I was 21, that's all that I did. So I was sick a lot. I mean, my energy level was low, my vitality was not high. It was almost just trying to struggle and basically stay alive day to day rather than thriving day to day. So when I turned 21, I started having quote unquote this other secondary condition, chronic pain. And so of course I go to my physician, and this was right in 2003 at the peak of the opioid epidemic. And so it was like, oh yeah, here's a Percocet. They say that chronic pain is another secondary condition. So of course, like I am trusting in the system of our health. I am trusting in the guidance. And so I take that. Well, basically it all of those things without moving my body and just sitting in a wheelchair and consuming that medication basically became a very significant mask to all my basically a mask to my symptoms rather than addressing what I really needed, right? And so I got very sick. I became bedbound, 59 pounds. I had to be hospitalized. I was being fed intravenously through a feeding tube that I had to have inserted. So with all of that, again, I had this moment of like, I am in an acute episode. I need to use the medical model to save my life. And it was interesting to look at that cycle because I used it to save my life from being injured, but then I had to use it again because I overutilized just the model itself. So when I recovered, we had to have a really deep conversation about like, how are we going to do this differently? How are we going to redefine how we approach my spinal cord injury? Because I'm not going to go back and do that again. So that was my injury. That was there was a moment that was the catalyst, which well, I'll jump right into that. I apologize because this portion of the story is so long, but yet the catalyst was basically my sister, who had been a yoga instructor, just said, why don't we start looking at integrative health and integrative medicine? And so that's what we did. I started doing acupuncture, massage, and chiropractic and physical therapy and all these things because basically those things were giving my body movement, lymphatic drainage, blood circulation. Like that's what my body needed, not just to sit there and pop a bunch of medication. Doesn't mean that I chose that only over medication. It's the blend of the two that created a really good recipe for me. And so I sit with you today because that model is literally what saved my life and then became the catalyst for what we're going to talk about a little bit more, which is the Chanda Center for Health and what we do on an advocate level, legislative level, and a service level every day for the last 20 years.
Can you tell us what integrative therapy is and about the therapies your center offers? And also, what benefits have your patients experienced from these therapies?
Absolutely. So, basically from that catalyst, I learned that what had happened to me wasn't just my story. It was a opportunity to help other individuals with long-term disabilities. And so that was the creation of our organization. And at the center today, what we do underneath one roof is we provide acupuncture, massage, chiropractic, physical therapy, care coordination, which is kind of healthcare navigation, so care coordination, behavioral health, and primary care. All of those are underneath one roof with the lens of disability competence, with the lens of being therapeutic and not sterile and white, but welcoming and warm, and also within a building that is extremely accommodating and accessible. Because I always talk to people and I say that I go out in the world still 30 years post my injury and I run into barriers every single day. And what's really difficult for me is I have come to realize that that's just the part of my process of having a disability, but I am not willing to tolerate having those barriers in healthcare because I truly believe that healthcare is a place where we all should feel a belonging and should feel a place of, it's a safe space where regardless of your condition, regardless of your disability, like there should be some competence and there should be a level of awareness and impact. And so we have really created that environment at the center. And I can only hope that that model and that service model, where again, these are services covered under Medicaid. We're becoming a Medicare provider. We're going to be looking at other payer mixes. And so and we've chosen to be a provider of some of those, government assistant programs, because that's often where folks with long-term support services or long-term disabilities or temporary disabilities land, because the cost of care amongst life is too much otherwise.
I couldn't agree with you more. And I'm so glad to hear that you're working with all of these government agencies to get care for people who would otherwise not receive it.
Yeah, I think the underserved population, like there are peeps. That's who we want to serve. And you'll find providers that, like, again, I understand we all have businesses, we all have bottom lines, we all have livelihoods, and unfortunate, I mean, just I guess not unfortunately, but fortunately, it's just that there will be providers that know that that is the population they want to serve because they know what is needed there. They are not going to, abandon the underserved. And I think that there needs to be a level of diversity in healthcare, and diversification of, impacting everyone's life is just, it's essential for all providers in our communities to be thinking about.
Well, as someone who has both received care and helped build systems around it, why do you think the caregiver patient partnership is so important for creating effective healthcare?
So I think that caregivers play such an essential role in the lives of those that become injured or have diagnoses, and because really our day ends and begins with that person. Without them, I mean, just I'll give my example. Without my caregivers, I don't get up every day in order to do what it is that I'm sharing with you. And so they play a critical role, not only in sustaining my wellness within my home, but they play that critical role of allowing me to be engaged in community at the level that I'm able to, and to also get to places to access healthcare, right? And so First of all, I wanted just to point that out because I think often caregivers are forgotten in community. And I think that every chance that any of us that are the caregivees can, throw that out and recognize it, it's really important. I think that I would say there's been more awareness around caregivers. I think there for a while, there had been, so much, like as I said, that community had gotten kind of lost and forgotten. I've seen a lot more movement to ensuring that caregivers are getting their needs met as well. I see retreats all the time coming up, and so I'm loving and seeing that we're having community engagement and changes around that, because I think that, as we all know, when caregivers burn out, like that's when the world stops, especially for those that need the care. And so we at the center just really recognize that, yes, our participants, those with the long-term disabilities, are the primary participants, constituents that we serve, but there are often times where we are always ensuring that we offer a level of support to the caregiver, whether that's getting an actual treatment, right? Whether that's being part of some sort of support group, or being connected with another caregiver that's going through the same situation with some of the variables that match, right? Like they're caring for someone that has similar experiences. And so I just see that component of our role is just essential based on the population that we serve.
Well, I love hearing the perspective from a care recipient. And I also love hearing how much you advocate for caregivers, because yes, burnout happens, and it happens without you even realizing it. And all of a sudden you're burned out.
Exactly. And I think that oftentimes it's really important to identify from the caree, the person receiving the care, is that how can I contribute to not making that happen? So for example, I set up my model knowing that, I'll have somebody that cares for me Monday through Friday, but then they have the weekend off and I have a weekend person. And so just as much as it's good for them to have that separation from me and some downtime, it's even essential to me to have a different person coming through my door to give me a different environment. And so it's such a strong relationship. I always say, caregiving can get really messy really quick, but yet with strong boundaries and strong communication and strong ways of supporting each other, like it can work out really well.
Well, we talked about burnout a little bit, and I know firsthand how emotionally exhausting caregiving can be, having cared for my husband for full time for 12 years. And then also navigating systems that don't always work. So, in what ways have you witnessed caregiver burnout? And what advice do you have for caregivers facing those challenges?
Yeah, I think the biggest component of caregiver burnout that I've noticed is that within certain systems, in terms of not doing better education to the individual that is receiving the care, if they're cognitively available to get that education, or to even educate the caregiver. So, and what I'm talking about specifically is just like how people get paid, and are they getting paid well? So what I've noticed within our community is that oftentimes you will get a certain like allocation for your, whether it be through a home healthcare agency or through a consumer directed program. If you're lucky to have that, oftentimes caregivers don't even get paid. They just have to show up, right? And so I want to note that reality. But then for the caregivers where you are lucky enough to have those allocations, I think that there needs to be a lot more education around like, how can you maximize your dollars to say, hey, let's get this much done in this many hours so that we can pay more for fewer hours, rather than trying to make your caregiver work so many hours for the littlest amount of pain. which is going, or the littlest amount of so a lot of hours for less pay, because I feel like that's when the burnout is out of control. But I think just because the individual that can maybe direct those dollars doesn't get educated, it just becomes this perpetual reality that never gets broken. And so one of the things that I've always done is that if I take really, really, really good care of my caregivers, knowing that, like, yes, I need a certain amounts of hours in the morning and at night, but I'm going to make those hours count. I'm going to make the pay increase. And like, I don't want a caregiver with me all day. So I have to do the things that really suit my situation, knowing that I'm only expressing an example of my situation. I know that there's other folks that maybe higher level or cognitively can't be left alone. And so there is creativity that has to be set there. But oftentimes I think that's one component, as well as just ensuring that there's a network of support that really can allow someone to step away and either step in, whether it's paid or not paid, right? And so I think those are the biggest systems pieces that I find extremely frustrating. And then just most recently is even like under certain programs, a lot of the caregivers aren't given the option of PTO or healthcare benefits. And so it's like, it gets really out of control very quickly, and does put the caree in a position that's like, wow, how am I really going to convince someone to serve me and care for me when under these certain constraints? But I think creativity is always essential in these in those situations. And yeah, I think those are the biggest pieces that I've seen in my situation and those around me.
Mhm. Well, you mentioned having a network, and I think that that's so important to any care provider and care recipient, that you have a network that you can reach out to in case of any kind of emergency, or just needing support.
Yeah, because it can, I mean, I think it for both parties, I mean, it can get lonely. Like, and sometimes, we have participants that don't have families, like, and so they have to create a network of people, whether that's through the center, whether that's through the center plus all these other, resources that we or other entities give them. But I recognize that it can be hard to have a support network, especially if you're not outgoing or you don't like to advocate. And so I, I think that that's one place where there can be improvement or support for those that just don't, maybe want to have that personality to be able to, like, oh goodness, how do I start? How do I even start getting a support network? Like, that's a feat in itself. And so, but yeah, you're totally spot on that need of having it.
Well, if you could speak directly to caregivers, what is one piece of advice you would want them to hear?
This one's hard because it sometimes it depends on the scenario, right? Like, if you're caregiving as a default to a family member, a loved one, that's one thing. But I think that if you're choosing to be in the caregiver world, my advice is that be okay about being picky who you're caring for. And I know that that can't happen with family members because, it's your mom, it's your dad, it's your husband, it's your wife, it's sometimes even your kid. And so I think that if that's not the scenario and you're going to be a caregiver in another capacity, it's okay to be picky about that, in the sense that you will find the right match, whether it's the energy that you feel every day of conversations, how you work well together, all of those pieces. I think that's one piece. But then also, just like, are you able to have difficult or conflict resolution kinds of conversations? Because oftentimes if you choose to be in that role, oftentimes it becomes your career. And so you've got to take the initiative to also know, like, I want to take care of myself, and I want to choose who it is that I care for if I have that opportunity.
Great advice. And I love your advice to be picky about who you work for. But I'd like to also say the same goes for care recipients. Be picky about who you choose to care for you.
Absolutely. I agree. And I think everyone can pick up pretty easily. I think if you're new to caregiving or new to receiving care, that might it can take a while to catch on to what it is that works best for you. And that's okay. Life is messy. It can be messy. So don't judge yourself in the process. But you're absolutely right. I think that both parties have the right to be picky, because I mean this is our lives, like this is what we're going to be spending our time doing, and that's something to be picky with.
From the patient side, is there something you wish caregivers understood, maybe something that patients wouldn't normally say out loud?
Yes, one of my biggest is that oftentimes I might be a person that will kind of run through a mental checklist in my head as the person being cared for. And when I run through that mental checklist before my care leaves the house, oftentimes I have ran into situations where it's like, I know how to do my job, or I know what to do. I don't need you to tell me over and over. Yet there have been multiple times where we all forget because we're humans. And so I think it's really important to not take the accountability that someone that's receiving care to be accountable to their own care as any sort of personal attack on their inability, whether that's memory, skill set, whatever. I think it's really important for them to not take that personal, because I always have reframed it with my caregivers is I'm your teammate in this. This is my care. You're giving it. We're teammates. And so I'm always, always, always going to look out for my care, because the buck stops with me. And if you forget, I'm your teammate to remind you. So it's almost just being really sure that you articulate it and reframe it in a way that's positive, rather than ignoring it and noticing that your caregiver is frustrated. Because if you don't and they leave and the urine bag was not open, or this wasn't left for me to be reached, or it can literally mess up a pretty significant portion of your day. And so I've had to balance that my whole life with caregiving, and it's okay. It just has to be. That's usually my biggest advice to caregivers, because I've had to reframe that and just be like, we're a team here.
That's a great way to look at it. And I was my husband's unpaid caregiver, and we had hired caregivers that would come into the home to give me a break to help me because he was 24/7 care. And you make a really good point um, about that communication with the caregivers and how important it is to make sure that all of those things are taken care of. One of the things that I dealt with was sometimes they would have to give him medications. And if I didn't check with them on that before they left and didn't know if he had the medications, then it could cause a serious problem.
Absolutely, yeah. And it's sometimes it's things that are literally to the individual's livelihood, because if the right medication's not given, the dosage, the time, I mean, it can be some serious stuff. And so it's just really essential that people don't get offended by that level of support and reminders or just saying, you know what, like I'm going to handle that portion of the care rather than you. It's not because I don't trust you. It's because there are just that's a piece to him and I that is just a little too critical, right? And so it can be across the board. And so I mean that's such a great example. And having caregivers come in to relieve you, the whole point is to relieve you. Don't actually make more work for me, right? And so I think that's a whole nother conversation. And I experience that too. It's like if you're my primary caregiver, then you're going to keep leaving whatever that is in that particular spot in the house. Who else do you think's going to move it? Because I can't. So it's like I just it's really I think that there can be a lot of humor in caregiving as well, and oftentimes I think that can get you through some of the hard times because it can get mundane. It's like you wake up and it's the same routine every day, and so it's like how do we get a little fun? How do we play more music? How do we make sure that we're sharing parts of our lives that we feel comfortable sharing and laughing about things, I think is always important too.
Yep. Making life a little bit lighter because it's pretty heavy when you live with a serious illness or a chronic disability.
Absolutely. Any chance we can, let's make it light.
Well, when caregivers receive practical support like respite care, financial help, or better training, or any training at all, because I know a lot of caregivers don't receive any training, how does that improve outcomes for people with disabilities, and what systemic changes do we still need?
I think that initial and ongoing training is really important because I think that oftentimes there can be progression of disabilities. And so, and I also just think it sets people up for success because I do see that there's caregivers that specialize in certain things. Like, when I'm searching for a new caregiver, I often will use an app to find new caregivers. And you can tell that there's those that really are focused on memory care. It's funny because I always have to put myself, they don't even have like a long-term disability category. So I always have to put myself in the senior category, and then in the kind of profile make sure that I'm not a senior. I am in my 40s, and I'm a quad, and I need these types of everyday supports at these times in activity, or these times in activities of everyday living. And so I think that it's great that people specialize, and I think that once they have identified a population that they love to care for, that ongoing training is really great because we're in a world where more research and more things are becoming present, that if they knew, they could probably make their care potentially easy for themselves and have those outcomes for the individuals. One that comes to mind is just better transfers. Knowing how to transfer someone is like so essential for the person you're caring for, because you don't want to hurt them in the midst of a transfer, but you don't want to hurt yourself. And I think that there has been very little education on transferring, the different kinds of transfers. When you see that somebody has progressed to, oh, it's too difficult to do this, okay, well, the next type of transfer that's going to offload more pressure to you and the individual is moving from a sliding board to potential like independent Hoyer lift, or knowing that a pop, you were doing a pop transfer, and now you need to use a sliding board. So it's all about really being aware about whether the person's diagnosis, disability is progressing, staying the same, and how is it feeling. I mean, and we're all aging, right? So we have to be mindful of like what can your body sustain as it ages, and you may stay serving and caring for the same person. So I think the systems changes would be that just making sure that there's more of specific kinds of training in those areas. And I mean, for me, it would be hopefully offloading the cost from the caregiver as well.
So that training comes through the care agency that they're working for. Is that what you're saying?
Yeah, it could come through various. I think it could work for the agency. I know that here in Colorado, if you don't choose a home health care agency, through depending on what payer source it lands under, there's I'm under the consumer directed model. So if I wanted to give training to them, I would have to figure out how to come up with it, give it to them, and ensure that they're getting paid for it. how I've always addressed it with my caregivers is I'm constantly giving them points and tips as we're going along and ensuring that there's open communication about if this becomes too much, let me know. Because if you don't let me know, then I won't know, right? And so I think that's one of the biggest pieces is like if you're deadlifting and it's starting to hurt, like then that means no go, let's stop. Like let's start to transition to a different type of transfer. And I'm just using the transfer as one tiny piece. There are multiple other pieces to the care. But I do think that I have seen that being, one of the most significant pieces where it either causes injury, causes frustration, doesn't allow someone to continue working if accommodations aren't offered. And so, yeah, so I think that, and then it would just rely on whether there's the funding source or the systems to support the cost of it.
One of the things you mentioned was communication. And I think that's so important from the very beginning of your relationship between caregiver and care recipient.
For me, I think communication is like the key to life. Like we're here as humanity on the world, and you know, we have to communicate. We have to, without it, we just don't get from point A to point B. And, for those that are nonverbal and need assistance, and whether it's, some sort of device or whether it's a particular a board that they use to speak with, I think that it's essential to also make sure that the caree that doesn't have a voice is still in the conversation, in whatever community capacity that they have, for as long as they can have that.
Well, let's move on to Medicaid because you have done so much to advocate for the people in your community in the Denver area. I want to know, how did the Chanda Center for Health get Medicaid to approve integrative therapies in Colorado, and which services does Medicaid cover?
Yeah, so when I was kind of backing up to my original story, when I was injured, when I started utilizing the integrative, the acupuncture, massage, and chiropractic, I in noticing that, like, wow, I just, it saved my life, and it is something that I'm going to have to find a way to sustain as a type of service for the rest of my life, knowing that my spinal cord injury is not going to go away. Being in your 20s is great because sometimes, I'm not there anymore, but when I was there, like, being naive can be one of your best friends. And in that moment it was. And so I called up Medicaid and I said, hey, I used to call 911 all the time. I would use the ambulance. I would be in the emergency room, like literally thinking I'm on the verge of death because I was like, something was always like hurting and going on with my body, to where now I don't call anymore. I don't go to the ER. I'm not doing CAT scans and MRIs every other day, in hopes that, oh, what we did yesterday didn't show what it's going to show today. And so I had shared this with the person on the phone, indicating that even if they looked at my Medicaid claims, they would see a dramatic shift in the cost. And she was like, and so I said, can I get these services covered? Acupuncture, massage, and chiropractic is what I advocated in that moment. And she just said, but no, we don't cover those. And so I said, okay. And this was the fun part. I was like, let me talk to your supervisor. And she's like, well, my supervisor doesn't make those decisions either. It's our legislative body. And so light bulb goes off, and I am completely motivated to say, let's do it. Like, this is the next course. So that was there was two things that happened kind of amongst the same, like, parallel of time, which was, one, I knew that I needed to start a nonprofit in order to advocate for this this type of service to folks with long-term disabilities, with funds to cover costs that individuals couldn't until Medicaid would cover it. And so I knew that process. So basically right away, I'm like, let's hit this from two angles. One, from a systemic legislative angle, from a let's direct service and funding angle now. And so in 2009, we went to the legislation and we had a pro bono lobbyist. That pro bono lobbyist really kind of showed me the ropes the first year. The second year, we got a House representative, a Senate. We ran the bill, and we only had to run it. It was the second year that we ran it, and we passed it. And so what that meant was that right away we did it as a pilot program, and we asked only for the Denver metro area spinal cord injury and for acupuncture, massage, and chiropractic, because we just wanted to like give us a bite of something, like give us a carrot so that we can show you the cost effectiveness and the improved quality of life with a more narrow geographic and demographic scope. And then from there, we would have outcomes to then show that, hey, it's working. So now that it's working, let's look how we can save more costs with other populations. So that's what happened in 2021. We went back to the legislation and said, hey, this independent evaluation that was covered by some of the dollars from passing the legislation shows that there is a cost effectiveness, there's an improved quality of life. So we want to expand the waiver, which is the CIH waiver in the state of Colorado, complementary and integrative health waiver, and it covers acupuncture, massage, and chiropractic for the entire state. And now it includes the spinal cord, brain injury, MS, CP, and spina bifida, and some other gray neurological kind of diagnosed disabilities that are not defined specifically by a particular name, but rather does fall within, the change of the ICD-10 codes that are out there and can get very granular and specific. And so, as of today, that is the waiver that covers those three services. And we are a lucky entity that became a provider of the waiver, because we found that after passing the legislation, similar to what I said earlier with you, is that very few providers want to serve this population. And if they do want to serve this population, they make it like maybe 5% of their patient panel. And so for us, we were like, we want Medicaid and Medicare, especially Medicaid, to be 90% of our panel, because that's the population that is underserved, that lands in these government programs and needs this level of support.
Do you know if there are any other centers across the United States that are like yours?
So we've done some research to identify whether there's other organizations like ours, and we haven't found one yet. So we'll find clinics that are identified, as a medically qualified or a FQHC, and so federally qualified health center, where they might have primary care, behavioral health in the same clinic, but nothing as comprehensive as what we do, and doesn't focus solely on folks with long-term disabilities. It can include, again, disabilities the first for us, knowing that regardless of who you are with a disability, you can land in so many other areas. You can be a person of color with a disability. You can be of a different, sexual orientation or ethnic. For us, we focus on the disability part of it and the access to the care and that long-term support service piece, whereas these other clinics are limited in their scope and also don't usually focus on those long-term disabilities, more of the maybe I don't know, let's say low-income families versus that, so that's what we have noticed. And so we have tried to really be an example to show that there's opportunities for states and advocate organizations of folks with disabilities, that this is a model of reality that is sustainable, because this year in 2025, we're celebrating our 20th year, and that doesn't happen without, sustainable models and ensuring that you're doing whatever you can to remain to be in existence in order to serve that population.
Well, what advice would you give to someone trying to obtain a Medicaid waiver for integrative therapies in their own state? But also, what would you recommend to somebody who's looking at starting something like the Chanda Center for Health?
I often tell people when if I'm on a podcast or whatever it might be, a panel speaking or whatever, I always say reach out to us. Like we've done it. We have a playbook. Like we are not trying to create a model that's not replicable. Like we will tell you like how we, strategized going through the legislation, which was very much coming from a consumer point of view rather than a provider point of view. And it like creating the center, it came up with like having to raise a lot of money, right? And so I think that we have always encouraged people that we have experience, we have a roadmap, and we're not holding that roadmap secret. And so we really encourage people, if they want to know more, to reach out to us. And I think one of the biggest pieces is just that you look into ensuring, which again, like you've asked, I don't think that there's been one clinic that we've seen that is exactly like us, but oftentimes we recommend that rather than recreating, but that you collaborate. So for example, we have different other nonprofits that will come into our clinic. So for example, we partner with the Jefferson Center for Mental Health that comes into the Chanda Center and delivers the behavioral health services. So it's, instead of recreating or taking on an ownership of a certain particular service that has not been, part of our core services, we're going to collaborate with others to come in and deliver it at no cost to us, no cost to the individual, and bill Medicaid on behalf of those services. And so I always encourage people to ask for help, to collaborate, and just be really mindful about the sustainability.
Well, we'll include links in the show notes, but can you also tell listeners how they can find and learn more about the Chanda Center for Health?
Yes, you can go. I always recommend people going to our website. So it's chandacenter.org. And from there, it talks about all of our programs, and there's contact form. And so I just encourage people. We have, you can meet our team, you can identify, there's different people that you can reach out to, whether that be our executive director all the way down to, accounting or our care coordination. And so I just really encourage people to go to our website, to learn about us, to read about us, and then really identify when they reach out, what specifically are they seeking either guidance on, or if there's somebody that's listening and they're just like, wow, this is an organization that I want to make a gift to, they can do that, because it's like the support is what makes us reality and allows us to be a model, hopefully for as long as we can, for others to build it in their own states.
Well, what do you most hope people take away from this conversation?
Oh, that's a good question. I think hope for me comes to mind right now. Like I really genuinely think that this conversation and what it is that you're doing for your listeners is offering opportunities to feel hope and hear from other perspectives, whether it's other caregivers, other those receiving care, of the dynamics that come with the direct care, the systems that impact it. And so I think that people have to really decide, where it is that they land on their comfort level of, hey, I want to get involved and I want to advocate and I want to do this, versus like, hey, guess what? Not everyone has to do that. You can just simply be a caregiver and not do that, right? But I think at the end of the day is just having hope for change, hope for knowing that you're not alone, hope for knowing that there is progression and there's change and there's opportunities where community is coming together to have these kinds of conversations.
Well, Chanda, you set such a great example for all of us that we can use our circumstances to make the world a better place. And I have really enjoyed getting to know you. Thank you so much for being here and taking time to have this conversation.
Thank you again. Like I mentioned, I'm so honored that I got to do this today, and thank you so much for those kind words.
Thanks so much for listening today. And be sure that you hit that subscribe button so that you don't miss out on a single episode. I'll see you next time.